Okay, we are going to do some comparing here today. We are going to compare holistic and conventional medicine. And knowing that we haven't yet started dividing these holistic practices down, we are just about there. But this week, what I want to do is start with a little bit of comparison. This is a chart that I have taken from the American Holistic Medical Association Guide to Holistic Health, which is a book some of you may have purchased for this course, although it's not required. And Dr. Robert Eifker, who is an osteopathic doctor, is credited for putting this together, and I've adapted it a little bit. So what this chart does is it compares holistic and conventional medicine, knowing again that there's lots of different options for the holistic medicine. So these are sort of just a theoretical comparison. And what we're going to do is we're going to look a little bit about philosophy, the primary objective of care, the method of care, diagnosis, treatment options, and secondary treatment options. So on the left, of course, you see the holistic medicine, and on the right, you see conventional medicine. And so philosophically, these are very different. Holistic medicine, at least currently, and this probably doesn't apply to all practices, but the philosophy is really based on an integration of all that holistic medicine has to offer, all that integrative medicine has to offer. So it's integrating the allopathic or the conventional, osteopathic philosophy, naturopathic philosophy, energy and vibrational medicine, as well as ethnomedicine, which could be translated as botanical medicine. And then, of course, we could, in naturopathic, osteopathic, and I probably should have chiropractic on there, but with the manual medicine, we were kind of thinking about osteopathy. So it's really about integration and taking different bits from all sorts of practices and building your philosophy on all of those kind of moving parts. Whereas conventional medicine really is based philosophically on allopathic medicine. It's completely conventional, right? They don't, in a traditional setting, think about anything other than the allopathic model, which is, really drugs and surgery, which we'll see later on down the road there. So the primary objective for care on the holistic side of things is the promotion of optimal health, of course, and then by promoting optimal health, the result would be hopefully preventing disease, ideally, and or treating disease if it's already evident. So really it's about promoting optimal health, and emphasis is really on prevention, whereas, and I think this is where probably the biggest difference is, or one of the biggest differences with conventional medicine. We aren't really so much thinking about optimal health necessarily in the way that the treatment modalities are set up. Not to say that doctors aren't interested in their patients being healthy. I don't want that to be construed to be stated that way. But the modality and the treatments are really looking at curing and or managing symptoms, which would be another way to say mitigating disease. Most of the time, what conventional medicine is doing is it's mitigating disease. There's very few examples of curative action, except for maybe in the case of like a trauma or like a infection that can be resolved completely with an antimicrobial or an antibiotic. That would be a good example of curing. The primary method of care with the holistic medicine is, again, we've been talking about this, but it's really to empower the patients to heal themselves. Really, I think philosophically, the sort of underpinning philosophically is that all people have the potential to heal, right? And so the job and the method of care here is to empower patients to heal themselves by giving them the tools they need to, one, identify their root causes, which is not always easy. So start to put all those pieces of the puzzle together, which can take some digging, and then encourage, of course, all of the positive lifestyle changes that will help to resolve those root causes and ultimately empower them to be healthy and stay healthy. That's another big part of this. The primary method of care of conventional medicine is to basically put the focus on the elimination of the physical symptoms. So it's really symptom-based care, right? Which we saw in Escape Fire, and we've talked a little bit about. In terms of diagnosing, there's a lot more similarity here, and of course this is going to be a little bit different with some of the different holistic medical practices and their scope of practice, etc., which we're going to get into. But in a general sense, diagnosis, holistic medicine utilizes the evaluation of the whole person, so a very comprehensive intake, a very thorough medical history, which is probably one of the biggest. So if any of you have been a patient of a person that's operating in this holistic medical realm, you know that it's a very different experience than if you go into your primary care provider at, let's say, Kaiser, right? Because the whole process tends to be a lot longer and a lot more thorough. So there's a very thorough holistic medical history. And at some point, maybe we'll look at some intake forms to sort of understand what that is all about. So holistic health intake forms, like ours, I think at my office is like 10 pages. It's ridiculously long, quite all kinds of questions and things, but it gives a lot of information. A physical exam, if provided the practitioner is licensed to do so, and the collection of laboratory data, again, provided that the practitioner is licensed to do so. On the conventional side, it's really, a briefer history, more symptom-based history, because the constraints on the physician are a lot more rigorous in terms of, practice management, and they don't have very much time, as we saw in the Escape Fire. We're talking like 5-10 minutes. 15 minutes is a long visit. So you can't get a whole lot of information in terms of medical history. A physical exam, it's usually a little bit more pointed towards the symptoms at hand, and then the evaluation of laboratory data. In terms of primary treatment options, the focus again on the holistic side of things is really applied to the whole person, body, mind, spirit, through diet, exercise, environmental measures. That's a big thing. We'll talk a little bit about environmental medicine. Hopefully we'll have time to get to that towards the end. Behavioral modifications, relationship counseling, bioenergy enhancement, all of these things. So you're building a very comprehensive treatment picture tailored specifically to that person. On the conventional side, the toolbox is much more limited, right? They have drugs and they have surgery. Whereas on the holistic side, the toolbox is much more expanded depending on the practitioner, right? But they're going to talk about a lot more stuff for sure. And then finally, with the secondary care treatment options, again, this is where we're really from my perspective, right? This is more, bigger modifications, lifestyle, etc. And that's hard to put that in a toolbox necessarily, but we do have them. But then we go down here, and this is where we really start to kind of expand. And again, it's going to be a little bit different depending on the practitioner. But this is where the herbs and the plants come in, botanical medicine, homeopathy, which is something we'll talk about, which is kind of in the energy medicine realm. Acupuncture, kind of the same, energy medicine. We'll talk about that when we talk about Chinese medicine. Manual medicine, that's where the osteopathic and the chiropractic people and the naturopathic practitioners as well learn manual medicine, right? Where they're, relieving subluxations in the spine and doing some adjustments to try to get energy flowing through the body better and releasing maybe some structural problems. Biomolecular therapies, I'd put like your vitamins and your supplements in there. Physical therapy, and then drugs and surgery. Drugs and surgery, for the most part, especially for naturopathic doctors, and osteopathic doctors, that's very definitely in the toolkits, right? We use we as naturopaths, I can speak to as naturopaths, provided you're practicing in a state that licensed naturopaths, California being one of them, we have a pretty robust formulary from which we can operate. It's the vast majority of naturopathic doctors don't use drugs right away, but they do use them for sure when appropriate. And surgery, of course, is part of the toolkit. For naturopaths, minor surgery, those kinds of procedures can be done, stitching, removing of skin lesions, etc. Osteopaths, of course, can do have a much more expanded scope of practice in that department. So you see kind of here, this is sort of flip-flopped, right? So the conventional paradigm starts with drugs and surgery and then may move down here secondarily to diet, exercise, physical therapy, and stress management. Whereas the holistic people tend to start here and then they move down to different modalities. So that's of course not the entire difference between everything that we have. We could consider strengths and weaknesses would be another thing that in the actual chart in the book, they talk a little bit about strengths and weaknesses. I would say the obvious strength of the conventional medicine is in the acute setting, trauma, hospitals, emergency rooms, etc. That's very definitely a strength. A weakness would be with chronic disease. Conventional medicine is pretty ineffective at managing chronic diseases over the long haul and maintaining health. One of the weaknesses, I think, and I'll talk about this as we go when we get into this holistic side of things, is because there's so many different sorts of approaches, it's hard to get what we refer to as sort of a standard of practice, which means that when you go into an acupuncturist, or actually I'll just say, let's say you went and saw 5 chiropractors for the same reason. You could potentially get 5 different treatments. They might all adjust you, but some might talk about the diet. Somebody else might want to give you this. Somebody else might want to do this. It's not a standard of practice. Whereas if you go into a conventionally trained MD with a condition, they're going to treat you based on the standard of practice. It's predictable, right? You're going to get the same kind of treatment for the most part from physician to physician. So I personally kind of consider that a weakness because it's just so broad. And you don't really know necessarily what you're going to get out of that relationship when you first go in. It might be a little unpredictable. It's also not a quick fix, right? If you want a quick fix, you're going to want to go conventional, right? If you want to take a drug, you don't want to change your diet, you do not want to take your, and we see this, I see this, I am pretty clear on the front end that this is a collaborative effort. And if you're not willing to put in the work, then I'm not the right person for you, because I know that's not a good balance, right? It's not going to work. I'm going to be frustrated and the patient is going to be frustrated. So if you're looking after the quick fix, then definitely don't waste your time and money with a holistic practitioner, because you're most likely not going to get what you want. I would say another strength of holistic medicine is it's empowering, right? And it's teaching people to take care of their own health, which in the long run is going to be cost effective. Whereas conventional medicine in the long run, as we wait for people to get more and more messed up and these illnesses to become more and more elaborate and more comprehensive, if you will, in the body, or widespread, it's going to get really expensive. So it's not a particularly cost-effective way. We don't wait, until somebody develops. You don't want to wait till somebody develops, let's say, type 2 diabetes, and then start trying to think about intervening, because at that point, they're going to have a lot of end organ damage. It's going to be expensive. So that's another way to kind of think about it. In terms of the conventional strengths, I think I mentioned some of them already, but I would definitely say that they are really effective in treating acute and life-threatening illnesses. That's where you want to go. You get into a car accident, you're bleeding to death. It's not the time to go to the acupuncturist, right? At that moment, you need to go into the hospital and deal with it. Potential to maybe facilitate your healing process after the acute episode. Then you can start to think about switching. And that, again, is the beauty of the integrative model, right? That's what makes this great. You can pick and choose. You can, and in my perfect world, which doesn't exist, but in my perfect world, the perfect hospital and or health facility, for lack of a better term, would be one where you have all of these people represented. You have an acupuncturist, you have a naturopathic doctor, you have a medical doctor, conventionally trained medical doctor, and everybody's working in this collaborative setting. That to me would be amazing. And I believe that that is what many of us are hoping to see happen when we overhaul this system. Whether or not it does, that's to be seen, right? All right, so these, in terms of holistic medicine, of course, historically, these are concepts are not new. This treat the whole person, everybody has within their reach the power to heal themselves. These are old concepts. They represent basically a return to these principles that have shaped the understanding of human health and diseases for thousands of years. And we'll talk a little bit about this when we talk about Chinese medicine and we talk about Ayurveda and even botanical medicine. We're not going to do a lot of that, but we'll touch on it. These practices that have come, like in the case of Chinese medicine and Ayurveda from the East, have emphasized this relationship between the body, mind, and spirit for thousands and thousands of years, right? This is not a new and revolutionary concept. It's just sort of a recircling or a return to what we had originally considered to be vital for human health and wellness. Even in the West, right? I think I mentioned in the previous video, the father of Western medicine, his name was Hippocrates. When a doctor graduates from medical school, in the ceremony, they take what they refer to as the Hippocratic Oath, which is multifaceted, but one of which is the one part of it that always sticks in my mind is first do no harm, right? So first you do what's in the best interest for your patient. And Hippocrates really, and we'll see some quotes from him coming up in various presentations, really did emphasize this relationship, this harmonious relationship between the person and their outer world, right? Oneself and their outer world, and how the outer world really shapes human health, right? That was a major teaching, right? He's the same guy that said, let food be thy medicine and medicine be thy food, right? This is not new stuff when we start talking about food as medicine, right? It's just gaining some traction for various reasons, and we'll kind of get into it a little bit how this happened. But we got off track here in the West, and we started to put maybe a little bit too many eggs in the basket of the drugs and surgery, thinking that that was sort of the panacea, that was going to solve all of our issues, which looked really great in the beginning, but hasn't actually panned out that way. So what I think we're seeing really, as you see in all cycles throughout, our universe, even if we're going to go that big, you see everything kind of circle around. Everything is cyclical, right? And so I think what we're doing is we're just sort of seeing this return to what we already kind of agreed on, and that was this relationship between ourselves and our outer world, and how we can't exist without it, right? It's shaping human health, and it's an essential component of human health and wellness. All right, so disease or dis-ease is another way to think about it, has been recognized as a consequence of a life out of balance, right? And we'll see this in Eastern traditions when we talk about Chinese medicine and Ayurveda, and also in Western traditions, right? Everything is about balance, and I use that term homeostasis, which I'm going to show you again in a minute, right? So when we are out of balance, we push our ability to maintain our body systems or our organ systems, and things start to get all messed up, for lack of a simpler, more complicated term, right? So a consequence of that lack of balance is disease, right? And so again, I think a really big goal of those of us working in this or interested in this holistic sort of space is to teach patients and ourselves, right? You might not be interested in working with patients, but you are a person that wants to probably live their life to their maximum capacity, right? In harmony with themselves and their environment, ideally, right? So we have to learn to do that ourselves. And we have, without getting on a soapbox here, we are far away from that, right? Our lifestyle has evolved, and I don't like to use that word evolution in this context because it doesn't seem really like usually in evolution, things change for the better, right? Or we become more adapted. In my opinion, we're becoming less adapted. Our environment is changing and we're not able to change with it fast enough. And we're maladapted to it. And a lot, in my opinion, of the chronic diseases that we're seeing are a result of that maladaptation to this environment that's gotten away from us, if you will, right? We're not in harmony with our environment. And that can be seen throughout all kinds of contexts, from just our physical environment with the toxins and all of the pollutants that we see all the time, right? And we'll talk a little bit about that when we talk about environmental medicine, but also the stress and the lack of sleep and this constantly driven and never ever getting any time to restore, sitting in traffic and doing a million things and balancing and juggling and all the stuff that we have to deal with, and the food that we eat, which isn't all that nutritive anymore, and the access to all of that, and the all of the stress that we have, right? That's not harmony with our environment. So I believe that the primary goal of healers, current and ancient healers, they already knew this, is to teach people to live in harmony, to recognize the need for balance, right? And it's very easy to say that, but it's not that easy to do, as I'm sure you guys know. But that's what we're going to try to kind of learn a little bit as we go through this. And we're going to learn it from a perspective of looking at some of these different practices and how they talk about that and how they introduce it. And there's really in my experience, there's no place better to learn that or I should say the best place to learn that is really looking at Eastern medicine and the history of that, because this is built into the framework, right? It's the crux from which all things shoot from in their framework. So when we think about disease and health, I should say, when we think about health, the components of health, there's all kinds of them. The diet is a big thing, right? Diet is, like I just said, let food be your medicine and medicine be our food. Back to that whole epigenetics conversation that I had in the previous video, I believe is when I was talking about this. We're finding that one of the biggest epigenetic factors is our diet. We can change our genes we can affect our genes, in a sense, turning on and turning off different potentially harmful or in some cases beneficial gene expression by our diet, which is so unbelievably cool. So diet is big. Hygiene is big, right? And without being crazy on hygiene, right? Hygiene is something that we've gotten a little wild about. And but definitely part of health is hygiene, right? If you look, just back to this country, like World War I, II era, when they were like, no one was washing their hands, right? Now you think like in hospitals, it's craziness. That was not something that we knew anything about. We didn't know about microbes. We didn't know about that. And it was like, who's going to waste their time washing their hands? They're going from patient to patient and everyone's dying and it's a mess, right? So a big part of health is hygiene, of course. Exercise, huge. A calm state, lack of stress, a calm home, a calm self, and some kind of spiritual connection. Now, that's broad, right? That can mean a lot of things. People have different spiritual practices. Some people are religious, you might be Catholic, you might be Jewish, you might be Muslim, right? But your spiritual practice might be meditation, and you might be a Buddhist, you might, be a yoga person. Whatever plugs you in to something bigger than yourself would be, in my experience, what I would call a spiritual practice. So all of these things, calm in the self, calm in the home, exercise, hygiene, diet, spiritual practice, right? And of course there's, social health, spiritual health, financial is a big stress, right? So I just couldn't fit any more things on the slide. But anytime you're lacking in if some of this is like overtly missing, that can cause disease, right? This is what we don't, I think what's missing in conventional medicine historically is that connection between the broad environment, right? Which is meaning lots of things, and the person. And that when those aren't harmonious, the body is going to pay the price, right? Our bodies are just the way that we adapt to our environment. So the American Medical Association has kind of always emphasized this principle that, or I should say the conventional paradigm has always emphasized that drugs and surgery are kind of where you start, and that's what you do, right? That's the treatment of necessity, always in all cases. Whereas we holistic people sort of think about that differently, right? Sometimes drugs and surgery are necessary, and there are lots of situations where, like, for example, type 1 diabetes, right? When somebody has type 1 diabetes, or probably more appropriately referred to as insulin-dependent diabetes, right? These people need insulin. Insulin is something they do not make. They need to take it in a drug form, right? That's their treatment. And that is 99% of the time the only way to really get any traction with that disease, right? That's a treatment of necessity. You would be remiss to not treat somebody with insulin that has type 1 diabetes, that's blood sugars out of control, right? But that's not always the treatment of necessity. In acute cases, very oftentimes it is, but in chronic disease, it's most of the time going to be inadequate, right? You might need to use a drug, but in that context, you're still going to have to work on all those other things. You know, what's going on in the environment, what's going on with the stress, what's going on with the sleep, what kind of a diet, right? It's not that easy. It's incredibly, these chronic illnesses are incredibly complex. And I think it's because our world is incredibly complex, and we as humans are incredibly complex. And we're all different from one another, right? And there's so many things that we have to kind of consider here. And again, like, I keep kind of going back to it, but that really it's really about that relationship between our external world and our internal world, and we have to be in balance. We have to have some kind of a harmonious experience. So this slide I think is interesting because Louis Pasteur, who you probably have heard of somewhere along the line, is credited basically the father of antibiotics, right? He was the guy who basically figured out penicillin, our first antimicrobial, which didn't hit the market until like the late 40s, early 50s. I think maybe 1952, if I remember correctly. Don't quote me on that, but not been around all that long. So he gets credited with being like the guy who's like got us on this drug train, loosely. That was kind of a joke, but interestingly, look at what he said. It's not the germs we need to worry about, it's our inner terrain. So he's saying, he himself, the father of antibiotics, said the germs aren't that big of a deal. It's what's going on inside you, right? It's how susceptible you are to them. And that, I think, is really was an amazing insight, right? You can have really robust, healthy people in a room full of germs, and they're not going to get sick. But you got one person that's tired, they haven't slept, you're stressed out, you eat a crappy diet, pardon me, my terminology there, and then you're the one that gets sick, right? So it's the terrain. And I think that was so interesting. We've forgotten that, right? We kind of jumped over that part and went straight to the drugs. Okay, so here's what we were talking about, but again, there are factorial approach, keeping in mind that the body, mind, and spirit all together have to be part of the approach. So we think about physical health, environmental health, mental health, emotional health, spiritual health, social health. All of those are things that we definitely want to ask about, right? Not just about your headaches or not just about your hormones or whatever. There's my favorite homeostasis, right? The principle of homeostasis that I talked about a few videos ago, referring to the body's ability to maintain kind of a stable internal environment in the face of constantly changing external stimuli. So the principle of homeostasis is referring to the body's capacity to maintain and repair itself by supporting the equilibrium within the various body systems. All systems in the universe operate on some kind of feedback mechanism, right? So that's a constant interplay, right? And so what we need to appreciate is the balance, the ability of the body the capacity of the body to maintain and repair itself, as long as you don't push it too far out of whack. If it gets pushed too far out of whack, then you've got a disease, right? That's what a disease is. So in healthy people, homeostasis, these homeostatic processes occur automatically, and the healing begins immediately. When we say we have the ability to heal ourselves, that's what we mean by that. Homeostasis will happen automatically and begin immediately, and healing will happen. You have to support the body and you have to do all those things, right? But it will happen, provided that it's not pushed so far out of whack. Once the body is completely out of balance or totally overtaxed, then that process, the ability to repair, becomes impeded, and that's what a disease is. That's all a disease is. Right? As you learn, if you continue on in your journey and start to study pathology and disease, which is just the study of disease, I always tell my pathology students, every disease is a disorder of homeostasis. If you cannot get back in balance, you've got a disease. If you can get back in balance, you're okay, right? So restoring homeostasis is one of the goals. To preventing disease and treating disease, right? So it, again, and I feel like I'm sounding like the broken record, but if all we do is look at the symptoms and we don't say why is this? Why does this person have a headache? Why does this person have high blood pressure? Why does this person have low thyroid function? The why is the homeostasis. What part of this feedback mechanism isn't feeding back, right? And that's the goal. The goal is to restore that, to remove whatever's in the way of balance. So, the path of health, again, people need to be empowered enough to participate in their recovery and their own health journey. That, in my mind, is a big part of this. Empowering means giving them the information about good nutrition, about a balanced lifestyle and exercise. These are all core requirements for health. You cannot have a healthy person without those basic tenets. And, in the balanced lifestyle, I'm going to kind of expand that a little bit to say like a reasonable amount of stress, right? Stress is a natural part of life, right? All animals experience stress, but they toggle between stress and restoration, right? You get stressed and then you restore and you rejuvenate and you replenish. We don't seem to do that very much anymore. Our lifestyle isn't balanced for the most part. Maybe some of you guys are, but I'll tell you, mine certainly isn't, and most of us don't have a lot of balance, right? Because there's just too many balls up in the air. And a big part of that is learning balance. And it seems so simple and so kind of like, a little woo-woo-y, if you will, but it's not. There's evidence to support this, that this is what we need, right? So those are all requirements for health. And once you have this harmony, once you meet these, requirements and you kind of know what you need to do, and then you develop this harmonious relationship with everything around you, your environment, which is broad, social connection. I mentioned that before. Social connection, I think, is so fascinating. It seems to be the most important thing, our ability to be connected to other people, right? We are social creatures and we need social connection for health. Mental, emotional, and spiritual stability are also, of course, essential for optimal health. And again, if we are really, truly providing health care, that is being provided to the person, not the disease. We are not treating diseases. We're treating people. I think that is the most important thing. So finally here, with this slide, just showing us that the road to health is a journey and it has to address our entire being. And holistic medicine really gets this. It respects these concepts. And for those reasons, it continues to grow in popularity. So as we progress from here, in the next video, we're going to kind of break down some statistics and look at, who's really using these modalities and what they're using. But from there, we're going to dive into the individual different types of holistic practices, starting with osteopathic medicine. So I will see you soon, and we will continue on our journey here.